And action. Hey everyone. So Sharlene had a question about trigger points, and trigger points are essentially areas of the body, usually muscle, where you can feel discomfort. But the origination, the reason for the discomfort is from someplace else. So the typical thing, as I mentioned, is chest pain. When you go to the emergency room and you're 50 to 60 or you're a smoker, high cholesterol, obese, usually the emergency room guys get really nervous, and they always think about the heart first because that's the most critical. And once the heart's ruled out, though, you go for the most obvious. The most obvious reason for left-sided chest pain is going to be from stomach, ulcers, reflux, gastritis. And same thing in Sharlene's symptoms, and I wanted to explain how that happens. So usually what happens is when you're a little tiny tadpole of an embryo and you're sitting in mom's uterus, the system is very easy. You just have a little brain, a little nerve, and then you have these little appendages. But as you grow, then because of how big we are, you have to have nerves work in a very compartmentalized way. So the backbone, where all the nerves originate from, as far as the body is concerned, not the brain, but the body, the backbone houses the big nerve roots, the spinal column, the spinal cord. And the cord sends out roots, and the roots go around the side to the front or down the arm. Usually because that's the way the nerve roots are, they're long. They start in the spinal cord and they go around to wherever they end up. In the case of sciatica, you'll have sciatic pain possibly down here from a pinch up here. Or you can have a piriformis where it's pinched at the muscle of piriformis and it'll shoot pain down just like sciatica. In the case of a pinched nerve of the neck, you can have the pain radiate down into the arm. In the case of something called double crush, you can have spasm pain, which is what I always have, up here in the trapezius muscle, and it can radiate down to the arm, or a problem with the carpal tunnel radiating to the fingers. But whatever it is, you can have problems at the distal portion because of inflammation at the origination. That's how a trigger point usually works. In the case of the stomach, because the stomach and the heart usually originate from the same spot in the spine, you can actually have pain up here from a discomfort down here. So it's sometimes referred to as referred pain, in fact. But either way, it's up to your doctor to understand the anatomy, understand the symptoms to look out for. I always teach my medical students about old carts as far as trying to elicit a good history and physical. And that's why it's really important to take time and have questions and answers to extract the information. Because if you can extract the information, the answer is right there. And then the treatment's right there. When we don't have enough time to extract information, or when you have somebody that's unconscious, it takes a little bit of a guessing game, especially if you're out in the wilderness. But these concepts of trigger points are not old, not new. They've been around for a long time, at least as far as Western medicine is concerned. Raiklin got his information, or he starts to talk about, he has treatment plans. This is a great book, treatment plans for how to take care of trigger points. And a lot of these treatment plans are based on Janet Travell's trigger points. Travell was, I believe she published back in the 60s, and she found that, again, people that were admitted for possible heart attack didn't actually have a heart attack, they had other things going on. And usually the treatment of choice is you take care of that spot that caused it, or that organ system that caused it, and then suddenly that distal pain goes away. Whether it's a pinched nerve, or whether it's symptoms like a stomach issue that's shooting into the arm or in the chest. Now, we might be patting ourselves on the back as far as Western medicine is concerned, but you know, in the last 300 years, we're pretty good with what we do, and testing is great. We have all these $1,000, $1 million machines, but the concept of trigger point and meridians and acupuncture, acupressure have been around for about 5,000 years. This book is not 5,000 years old. This is who I learned from, Joseph Helms, when I studied medical acupuncture. And he took his concept, it's more of a French-based acupuncture, from the traditional Chinese medicine approach, which is about 5,000 years old. Even marma points in Ayurveda or yoga. We have marma points. Again, you have the concept that was set down through several dynasties and still in use now of traditional Chinese medicine and acupressure, acupuncture points. And you have marma from Ayurveda or India, also about 5,000 years old. Two different continents, both boasting the same concept. Now, they're not exactly mapped out the same. If you look at marma points, there are certain marma points that are along different parts of the body, chakras or nadis, that can be stimulated to get a different kind of reaction, to get energy flowing. Same thing with traditional Chinese medicine. You'll have meridias that if you stimulate certain points of the meridia, you can have a symptom go away. In fact, when I touched on Sharlene's arm, it reproduced her pain. Actually, it was very tender to her arm, but it did. She did have pain to the chest, probably from the stomach, but regardless, we still had a trigger point over here. So the concept would be in marma or acupuncture, you take care of what's deficient, you get the moving of energy going, and then the symptoms go away. So that's the basic concept of how trigger points work. And so you can see how, at least in this modern technology world where you have million-dollar machines and $1,000 tests, that even if you come up with a diagnosis, it still comes down to moving muscle, moving arms. That's why it's so important to be moving. Because when you're stagnant and when you're on a keyboard for 8 hours, you're not moving, you're still, and that's not what humans are supposed to do. Humans are hunter-gatherers, are supposed to move with the season. We feel better when we're moving. We feel better when we're outside. When we have a problem psychologically, we walk away from it. We walk. So it is important to move. Even if you have a disability, if you're a paraplegic, if you're in a walker, you still have to move. You just have to do it in a different way. That's why I always talk about whether it's a trigger point in fibromyalgia or a disability or a pinched nerve, you always have to involve a coach of some sort to teach you and guide you and push you or to be accountable to. Whether it's a life coach, a physical therapist, a trainer, or a massage therapist or chiropractor. I think there's hands-on healing that can be applied and healing from the outside that can actually affect the inside. I have patients that once they start moving, and this is typical for my older guys, they know that they can lower their cholesterol and lower their blood pressure if they get exercising. But what happens? 8 hours a day, 40 to 50 hours a week. Who has time? Well, if you don't have time, that's okay. You come see me now or you come see me later. When there's imbalance, you're going to pay in the end eventually. Hopefully you don't, but when time comes, then we'll have to invest in a movement activity, a mindful activity, and a nutrition plan. Whether we do it now or later, if it's done later, much harder. So getting back to this concept like with Sharlene, if we have anxiety, if we have a stomach upset, and then we have chest pain, and then poor sleep, and we have to finish up schooling, that's a lot of stuff to take care of all at once, so we'll still be able to do it. But if you do it early when it's just one problem and intervene with natural therapies, it might be easier to take care of or reverse more so than when you're older and you have like multiple problems. So I can't express enough how important it is to exercise or to move in addition to nutrition and mindful practice. But good thing is with trigger points, usually there's ways to kind of get massage or take care of it, alleviate symptoms physically. The problem is when those trigger points get onto link in or cause disease, then it becomes a little bit of a problem. But if you are empowered to make changes early and reverse your disease process, reverse your suffering, then you have a whole world of healthy lifestyle ahead of you. Good question, Sharlene.